Thank you very much. It gives me great pleasure to be here with you all this morning and to be back here in Korea. Actually, the last time I was here in Korea and I had a microphone in my hand, I was not in a conference. But it's always a bit of a challenge to give a presentation after Raj because his presentations are always so full of energy. But I'll do my best. I'm going to take us back to really looking at the legitimate supply chain, talk a little bit about, or a little bit more about quality management systems, which are so fundamental to driving legitimate supply chain, and also for setting up the infrastructure systems, processes and people that manage the integrity of pharma products and keep patients safe. But first of all, if I can get my slide to go. There we go. I'm not going to spend a lot of time on this slide because we've talked a lot in the last 2 days about challenges in supply chain. But I would say that there's absolutely no doubt that the pace of change continues to increase, and tomorrow is always going to be different to today. And some of the change that we see in the operations that we have is within our control, but a lot of it's not. And so it's not. It's really beholden on us to be able to adapt very quickly, and in particular to adapt to disruptions. But it's unfortunate that in periods of disruption and the adaptation to that disruption, that falsified and substandard medicines, the threat actors are increasingly finding opportunities. And so we have to be able to adapt to their agility as well and manage our systems accordingly. I want to talk a little bit about the importance of standards, and Ryan has talked to us yesterday about GDP and also quality management systems. But the background that I come from is a pharma distribution context. Operations in 16 countries around Asia, more than 80 warehouses, delivering to 225,000 customers, which are hospitals, pharmacies, drugstores, and millions of patients. So to be able to operate that ecosystem, you need to have a very, very robust quality management system. And when we're talking about good distribution practice, it is an international standard, but there are many different versions of GDP. And so when we're starting to put together a quality management system that we can work to, and we're working also across more than 300 multinational clients who also have their own interpretations of what quality is, we need to make sure that we've got what I would call a best of breed GDP. And so when we look at how we prepare that, because quality and the QMS will be the foundation of our operational execution, and we look at a number of different partners that we have, or a number of different organisations that we refer to. And those include the regulators, the EMA, MHRA, the US FDA, ICH, PICS, and the WHO. There are a lot more regulatory agencies that we refer to when we're preparing our quality documentation, but those are the core. And so you can see it's not a simple process. In addition to that, GDP in general is quite a high-level document. And so really to be able to develop processes, procedures to an operational level, because that's one of the roles of quality, is to interpret international regulation into a way that the business is going to be able to operate. So we look at organisations like ISPE, the PDA, USP, ISTA, which is the packaging organisation, ECA from Europe, which has a lot of detail about different subsections of GDP, and even our discussions with PSI and an increasingly important organisation in the region is TAPA. So we developed this best-of-breed quality management system, and it requires that combination of both robust standards and best practices that are giving us not just the high-level GDP aspects, but the operational aspects also. So the role of the QMS, as I said, is to really drive that operational understanding, and it applies across the infrastructure, the systems, the technologies, the processes and the people that represent the ecosystem that we operate for effective storage, handling, packing and delivery to customers and ultimately to patients. My slide's not working very well. One of the important areas when we talk about establishing the integrity of the supply chain is also the documentation side. And when I talk about documentation, I'm not really referring in a sense to pieces of paper anymore, but really their digital equivalents. And it is really important that when we're talking with manufacturers about shipments that we're going to anticipate coming into our facilities, that we have a very high level of awareness of what is coming and when it's coming, which helps us to establish that the product that's going to be coming into our storage facilities and subsequently distributed to patients is coming from a legitimate source. So two key documents from a quality perspective are the Certificate of Analysis and the Certificate of Compliance. And these obviously come after the manufacturing batch has been completed. And we hope that the manufacturers will provide them. They don't always. It can sometimes be a bit of an argument with them to get these documents. One of the other really important documents is the Advanced Shipping Notice, which by digital integration between client systems and a distributor system, we have advanced knowledge that the shipment's coming, but also the system's updated with all the necessary product aspects, the quantity, the manufacturing date, the shelf life, and the expiry date, those types of things. So these documents are really incredibly important. Also, at the time that the shipment arrives into a distribution facility, that the shipping documents are the correct documents, that the delivering company has also all the right credentials. The advance notice on things like the registration of the vehicle, the identities of the driver, and the company that is making the shipment. So these are key steps in ensuring that the integrity of the process can be established. Also, from a systems perspective, how we update the system of record and how we ensure that the digital integrations that we have with different software, so system of record may be SAP, there'll be warehouse integrations to that for warehouse management, there'll be temperature management integrations for the temperature monitoring, there'll be integrations for the transport and delivery with transport management systems. So making sure that all these systems have been through the appropriate computer system validation, and also that the data that's being entered through those systems is being entered in the correct way, making sure that all the operators that are involved with working with systems know the importance of data integrity, are trained in the importance of data integrity, and execute their transactions in accordance with Alcoa and Alcoa Plus. So the imperative when we talk about the chain of evidence between the digitised documentation and the key systems we have is really authenticity of source and ensuring patient safety. The physical storage aspects are also incredibly important to us, and the standards that we apply are a combination of what we see out of our good distribution perspective and the quality management system, but also increasingly the TAPA standards that are specific to storage facilities. So that's TAPA. Forgotten which the standard is, but the storage side and also the delivery side, the transport side. And these are very specific standards. And in Singapore earlier this year, TAPA also released a specific pharma storage facility verification, and are working on a transport version of the same for pharma. So it's becoming, because TAPA is also an international organisation, it gives us a reference point with our clients who are predominantly coming from Europe and the US. Again, the imperative here is to prevent theft, also to maintain product integrity, and most of all to protect patients. I guess one of the strongest areas of interest I've had as a quality practitioner who looks at supply chain through a quality lens, but also a supply chain practitioner who looks at quality through a supply chain lens. So I see risk in different ways, and there's no doubt that a very structured risk management process which emerges from quality and has been well documented in references such as ICH E9, provides specific approaches to looking at risk and designing risk assessment and risk mitigation programs. These are incredibly important. But it's not just quality risk, but it's also supply chain risk, and the practices that exist in quality can also be carried across to the pharma side. So we look at risk. I think we've discussed in the last couple of days risk from a macro level in terms of the global supply chain risk, but it also occurs at what I call the micro level within the operating context of the markets that we operate as well. And we need to make sure that market-specific issues can be managed with a risk management approach. Again, TAPA has been quite helpful in starting to develop these types of standards to assist with pharma storage and also pharma transport, and so this is also a new standard that's being pushed through the region. We can see a range of standards that TAPA is also pushing, and I spend a bit of time working with them on the formulation of these documents as well. So it's quite exciting to see that international standards continue to be developed, and that we are focusing very much on pharmaceutical storage, pharmaceutical transport, and also the potential in the future for the brand protection standards, which will also include the pharma side. And this is something that TAPA is promulgating, not just in the pharma industry, but across industries as well. Collaboration with stakeholders, I think, has been a key theme of the meeting over the past 2 days. And certainly when it comes to regulators, the responsibility that I think the private sector has too, to share the information that they have about the way that they manage quality and the way that they manage supply chains with integrity, and the ability to support the learning and the education within the regulators, I think, is quite important. Also, from a customs perspective, we have been active, highly active in working with customs authorities around the region, looking at training opportunities to work through the different scenarios that we see in terms of counterfeit, falsified medicines, and also cargo theft. I think we've talked a couple of times, and Ramesh certainly touched on this, the involvement of the law enforcement agencies in investigating and addressing counterfeit products. And I think certainly one of the opportunities for us is to increasingly build that interagency collaboration between the regulators, the customers and the LEAs, those international organisations which include the FDA and Interpol we talked about, Department of Homeland Security. So building the relationships and the collaboration to be able to build the understanding and the visibility of what exists and where the key risks are and how we mitigate those risks together, I think is quite important. Again, the imperative is enhanced detection, prevention of falsified and substandard medicines, and ultimately the safety of patients. I won't spend too much time on this slide because I think it's been the theme of this conference. But certainly my parting thoughts are that we need to collaborate further on the strategies that we use to drive enhanced surveillance. I think the discussions that we've had on the technologies that are available, certainly serialisation is a part of that, but also end-to-end traceability and how we build this visibility of product through the system. Blockchain has been used in different circumstances, but not to my way of thinking has it been used on a scalable basis. So we do get pockets of use with specific products, but it's still not a broad-based solution. In terms of the collaboration, the sharing of the data, the joint initiatives that we've talked about, and the international cooperation that I think this conference is a good example of, and that needs to continue. Again, the imperatives here are protecting public health and patients, the accessibility of the public to safe medicines, and also maintaining the trust in healthcare systems. And I think that's my final slide. Thank you.
Thank you. Okay, time for questions. Anybody? Anyone has a question? Everyone is looking at me, but I'm asking you if any one of you has a question. Okay, all right, so we do get one from the virtual participant. It says, what are your thoughts on sustainability in convening regulators, customers, LEAs for enhances surveillance for the imperatives you noted? That was the question.
It's a great question. Actually, in the car on the way here this morning, I was thinking that this presentation deck is a deck that, for the first time that I can recall in some time, I haven't used the word sustainability. That doesn't mean I've forgotten it, and sustainability certainly plays a very important part or the topic of public health care, accessibility of medicines, management of counterfeits, falsified, substandard medicines, parallel imports, is all a part of what I would see as a sustainability program. Certainly in my previous company, where product quality and safety was the number one material issue for the company. And so under the product quality and safety material issue, there were a number of initiatives that we were working on as a part of combating counterfeit, falsified, substandard medicines, parallel trades and those types of things.
Okay.
So it is a critical component. It fits under the social aspect of ESG, and sometimes when we're talking about sustainability, we don't necessarily see all those social aspects.
Okay. All right. Another question we do have here is that what is your perspective on the issue? Okay. One more time. What is your perspective on the issue of risk control related to users' behaviors or attitude? Do you have any advice or experience to share on this matter, especially for developing countries with lower middle income levels in Asia? So that was another question.
Yeah, I think this comes back to my comment about having a set of, when we look at GDP and we design a QMS, we build a body of procedures. These have to be standard operating procedures that people can execute against, which means we need to be able to, it needs to be an effective SOP, but we need to conduct effective training and education as a part of that process as well. And training and education is not a one-time thing. I think one of the areas of quality that I've seen a really major improvement over the past 12 to 18 months is a much bigger focus on effectivity. So it comes through even the management of deviations also. How do you design effective solutions? How do you implement corrective actions effectively? And how do you periodically review that the training you conducted and the actions that you implemented were effective? Now we have operations in a number of the low to middle income category. And I think probably one aspect that I haven't talked about, which I should have, is that aspect of quality culture. And so when we have a quality management system, we have the SOPs and we have the training and the education, we're also trying to build that culture of responsibility for quality. And yesterday we talked about why is quality important, because it's my responsibility. And the medicines that I'm distributing could be to my mother, my father, my brother, sister, neighbour, football buddy. You know, it's a personal thing. And so that type of ownership of responsibility applies across all levels of the organisation, and it doesn't matter whether you're in, you know, a Cambodia or a Vietnam or a Taiwan.